you know, how our students think we do. So please turn that in. Okay. All right, so parturition, that's what we commonly call delivery, okay? And it has 3 stages or 3 phases. And that is not trivial. You will hear people talk about the 3 phases of labor on every obstetrics floor for your whole career taking care of human beings, right? So it's important stuff. And essentially, all 3 of these stages work in the same fashion, and that is the coordinated contraction of the uterus. And because there's a baby inside, in a newborn, the head is the single widest part of the newborn's body. Okay? Not true after, a year of age. But essentially, babies are born with giant heads and little bodies, right? And then they grow into their big heads as they get older. So the next time you see a newborn, look at that. You can really see it when you really tightly swaddle the baby. You've seen that done, right? And you'll see that you can compress the rest of the baby's body smaller than its head. And no, they don't hate that. They love that. So a tip for your future parenting, babies like to be tightly squeezed because that's what they're used to. They're used to being all bundled up, right? So this is my vague attempt at drawing a baby. Okay, so here's the big head. I gave up on this part. Here's the big head. This is, neck and shoulders. It's all squeezed together like you see here, right? But the head's the widest part. And while a baby's head has a soft spot in the center, it has bones all the way around. So the head is not only big and round, but it is also hard, okay? So as the uterus it squeezes all together, and the uterus in general is sort of funnel-shaped. So there's a pressure this way, down through the center. Okay, so there's things, because it's pushing in all directions, this is the weakest spot, so the pressure is downward, okay? So as the uterus contracts against the cervix, okay, this is the cervix right here, the cervix starts to get thinner. It compresses. Okay, we call that effacement. So this process. So at the beginning, the cervix is quite thick because in part it's holding the weight of the baby up above the pelvic floor all the time that mom is walking around. So the cervix is much thicker at the end of pregnancy than it is pre-pregnancy, because the whole uterus gets bigger during pregnancy, okay? So, baby's getting pushed down. This thick cervix, the cervical canal is inside, but it's all tightly closed. In reality, it has a plug in it of mucus called the mucus plug, okay? And that helps to seal the uterine compartment from the vaginal environment during delivery or during pregnancy, right, to keep this nice and sterile, because the vagina is not sterile. So this mucus plug serves as a blockade. So contractions begin, and in first pregnancy, the time it takes to go from thick closed cervix to thinner opening cervix can be days. Okay, so when you hear people talk about, I was in labor for 3 days, well, that's the first part of labor. That's first stage. And you don't have to be in the hospital for that. So particularly nowadays, come in. We try to keep moms out of the hospital as much as possible. So a lot of the first stage happens at home. Okay, uterus contracts. It isn't very regular yet. It'll contract good and hard, and then it won't do anything for 20 minutes, even an hour. And then it'll contract again. And over time, those contractions get closer together. So when they start to be like regular a few times every 15 minutes, that's how you know it's probably time to go to the hospital, right? So contractions push against the cervix thins. So do you see how this is thinner than this? That's effacement. Okay, so the cervix is thinning. When it starts to thin, it does start to open a little. So the cervical canal gets a little bigger. That's called dilation. Okay, so dilation is the cervical canal getting bigger. Effacement is the thickness of the cervix getting thinner. Now, eventually, as dilation occurs, this mucus plug falls out because the canal that it was plugging has gotten bigger. So, boom, out it comes. Okay, moms often will describe that. That's another sign that baby's going to be arriving at least in the next week, right? Because that means dilation is happening. Okay, so the mucus plug comes out. Contractions continue periodically. Eventually, the cervix gets to be as thin as the rest of the uterus. Okay, so we call that 100% effaced. In other words, the cervix is 100% thin. And what you feel on examination of the cervix is it's just a little thicker than a thick sheet of paper is how it gets. It gets very, very thin like that. So once effacement occurs, the next thing that happens, baby's still head being pushed against the cervix. Now the cervical canal starts to be pushed open. Okay, so you see this happening here? That's dilation. So eventually, dilation is going to reach 10 centimeters. Okay, that's about like that. Okay, that's the distance, or yeah, it's more like that. 10 centimeters is considered complete because that's approximately how big the cervix needs to be for the baby's head to squeeze through. Okay, so once dilation is 10 centimeters, then we know that it's about time for stage 2, which is when the uterus, continuing to contract now in a very regular fashion every few minutes, is going to push the baby out through this thin, expanded cervix. Now, typically, sometime in here, the membranes rupture, right? So, baby is, yes?
Dr. Pete, when they say checking, are they literally checking, like, with that method to see how dilated?
Yes.
Okay, good talk.
It is very straightforward.
Okay.
Right, we call that a manual exam, and you use a sterile glove. Typically in the pelvic exam you don't use sterile materials, but because there's a baby involved, the baby is used to sterility, we do use sterile technique for that. And yes, you feel with your fingertip the thickness, and you feel with your fingers the dilation. Yep, very straightforward. Many of you will get to do that. Typically, by that point in the pregnancy, mom doesn't care. Mom could care less because she wants to know, is the baby coming? When am I going to be done with this brand new thing that she's doing, particularly first-time moms? Okay, so effacement, dilation. Now we get ready for stage 2. In stage 2, the baby is born. Now, I want you to notice this angle. Do you see how there's an angle this way, and then there's an angle this way? That's how the baby is born. It's a down and up. So like when you catch a baby, you take the baby's head down and then you go up because mom has this bend around her pubic symphysis, right? So the baby goes down and up. Yeah, you get used to that.
So it's real good for phase 1. Technically, when that mucus plug comes out, is that what they call like my water, like the water?
No, mucus plug is not membranes rupture. So my water broke is when the amniotic sac ruptures, usually somewhere between these two. So mucus plug comes first. And again, particularly first-time moms will say, what the heck is that? Because it's sort of this long, it's a cylinder, it stays kind of intact, and it comes out a part of you you're not used to things coming out of, right? So it comes out, typically it's found in the toilet, is where it happens.
Oh, is it like a color, or is it like mucus?
Right, it's clear, reddish. It doesn't look like a clot, it looks like slimy. Yeah. The water break? The water break is just the baby has been in this amniotic fluid, this amniotic sac the whole time. When that membrane ruptures, that fluid comes rushing out. And again, if mom's never experienced that, it can be sort of a strange thing because it's not a trivial amount of fluid. It's about 500 cc's. So it's like, whoosh. Yeah.
Does the baby's face have to be facing that way in order for it to come out? Like almost.
No, this is the standard. What you see here,
Yeah.
which is baby's head pointed backwards. Typically, the ideal presentation for the baby is this part of the head first. So it's kind of like a football tackle. You tuck your head in so your neck is protected. That's what baby does, goes like this. Now, there's all kinds of variants on that, though. So baby can be breech, butt coming out first. Baby can be legs first, almost like a parachute jumper standing their way out first. You don't really get sideways because there's no room for sideways. And you can get baby coming out like this, forehead first. So one of the things you learn in obstetrics is how to handle those different positions.
Because if you handle it wrong, can't the oxygen kind of be cut off at that point?
You can have head and neck damage. Clavicles get broken in delivery when the baby comes out, strangely. Legs can get broken less commonly. Because sometimes, like when the baby comes out butt first, you've got legs going everywhere. So you have to just manage it. Now, this still happens, say baby's butt is first. This happens slower because there isn't that hard head pushing against the cervix. So, but you can deliver a baby breech. You don't have to have a C-section. Yes.
So why would they use forceps?
Forceps go, well, there's different kinds. Today there's a suction cup type thing that you suck to the top of the baby's head. Gives the baby a handle, so you can pull a little down and out. The old school forceps would go here and here on the sides of the baby's head. There's new forceps that are more like spoons that kind of go like this to prevent trauma to the baby. Essentially, it's to help the baby make this transition through the birth canal. Okay, this is a tight fit. And in small moms with small pelvises, it can be a very tight fit. So it gives the doctor a way to tug on the baby. Because remember, babies are slippery. Okay, they come out. One of the things you'll all hear in your obstetrics rotations, those of you taking care of human beings, is don't drop the baby. And the reason that they say that is because babies come out, they're very, very slippery. So you have your plastic gloves on, you've got baby who's essentially been greased, right? So you got to hold on to the baby. So that's one of the reasons they use forceps is so they have a grip, something to hold on to pull baby out. Forceps use used to be really common, but it's a last resort really today. They'll use the suction cup first if they can. The problem with the suction cup is essentially you can get a big hematoma on the top of the baby's head. Kind of like a hickey, from suction pulling in the baby. And it looks terrible. It doesn't do the baby harm, though. Den's your question?
Yeah, I was just wondering, my niece had scrapes on her head when she was born from it.
Yeah, that can be them trying to get the forceps in place.
Oh.
Yeah. We've come a long way. Back in the 1940s and 50s, the fad then is moms were under general anesthetic during delivery. So they didn't feel anything, but they also couldn't participate in pushing at all. That was when forceps use really got popular, because without mom pushing and being able to move, a particular, in however you needed to move, you had to be able to grab the baby and pull it out. So down and up, remember that. Baby's head is on a neck, and the neck moves, right? So once the head is through, now the rest of the baby is flexible. So it goes, boom. So once the head is out, the rest of the baby comes out very, very quickly, typically. Unless you've got a big, giant baby. Then it can be sometimes hard. So baby comes out, down and up. And once the baby is delivered, the cord is still attached to the placenta. So the cord will go through the birth canal. Here will be baby, here will be cord. There's more cord than you think. Your cord is like this long. right? So you have some space. So they'll clamp the cord on both sides, cut the cord, then baby comes out. Typically, baby gets handed to somebody else because the obstetrician's got other things to do, which is, next comes the placenta. So once the cord is cut, the placenta, really in a cool way, detaches from the uterus. It lets go of the uterus. And then the uterus pushes it out. So after the baby, you get the birth of the placenta, right? And then the next thing that happens is the uterus has to contract to stop the bleeding from where the placenta contracted. So what you'll see is, to encourage the uterus to contract, the nurse or the doctor, the caregiver, or the midwife is going to take a fist and is going to rub right there on the top of the uterus. Rub it to get it to contract, make it angry, so that it contracts and gets smaller, and then the bleeding stops. Moms really hate that. Okay, so they've just given birth to a baby and now somebody's rubbing on their stomach, but it has to happen because the uterus, when it doesn't contract, that's when mom bleeds and bleeds and bleeds and bleeds. So it is worth doing. A good obstetrician or midwife or family practice doctor will carefully inspect the placenta before putting it in a pathology jar and sending it to the lab. What they're looking for is a completeness. You know, the baby side of the placenta is smooth and shiny. Mom's side of the placenta looks like a sponge. And you want to make sure that all the lines are nice and smooth so that you're sure there's no placenta left, no pieces left. Because if there is retained placental parts, eventually mom's going to have that cleaned out. Otherwise it becomes infected. So the placenta is examined, the uterus contracts down, and now there's a new baby in the world. So questions about those things? Yes?
How does this change when you have a C-section? Like, do you still go through most of those stages? Or?
Depends on the reason for the C-section. Okay, there's lots of reasons for a C-section. So baby's too big. You're going to have this. You're going to have dilation, effacement, dilation. And at some point, they're going to decide that the baby can't make this passage through this narrowest piece. Then what they do is, it's hard to show you in this picture, but they make an incision right here. And because the baby is pushing on the skin of the abdomen all the time, the skin sort of goes, it snaps. And then they go in, they cut into the uterus, usually way down low right here, and they pull the baby out, cut the cord, the same thing. And then baby goes off to the pediatrician in the case of a C-section, and they sew up the uterus, they sew up the abdominal muscles, and they sew up the skin.
Do they have to wait for it to be phased and dilated for 10 centimeters?
To do a C-section? No.
Is it better?
You know, let's say you're having a C-section for some other reason. Say mom is HIV positive. They can do it when it's looking like this. Now, speaking as a former clinician, it's better. Babies are better when they've had the squeeze of labor, though. So even though you can go in there at full term and you can cut the baby out, the babies struggle with that because part of the evolution, the evolved process, is the squeezing of the uterus on the baby does some things that make baby healthier for those first 2 weeks. One is it squeezes a bunch of fluid out of the baby's lungs. Okay, so babies doesn't have air in their lungs, they have fluid. When they're squeezed by the uterus, that fluid gets pushed out, the lungs get compressed, so then when they take their first breath between here and here, it's easier for them to inflate their lungs. So babies who have not undergone labor, they have a much higher incidence of respiratory distress. They have a much higher incidence of feeding problems. There's a whole slew of problems with the baby that go with the C-section. That's why pediatricians hate planned C-sections, because it's not good for the baby. Baby needs to be squeezed. Even if you can't get the baby out through the birth canal, that labor process is still important for the rest of their time. So like, I've been a part of, 500-600 births when I was in practice, and C-section babies are the ones that have the most troubles, And C-section babies that had no labor at all you expect the worst because it's just so common. They come out blue, they're slow to breathe, they're slow to wake up. Because this process, the baby's aware, So the vaginal birth process kind of gets the baby wide awake, and ready to do things. Because it's sort of like it's been in a car accident in slow motion for the last hour. So when it finally gets out and breathes, they're vigorous and they pick up right away. C-section babies, years kind of later. So you have to wake them up. So we rub them with the towels, and we don't smack them anymore, but we vigorously stimulate them to get them to breathe because they haven't had that experience of birth.
You know how sometimes mothers will have C-section and then often, like subsequently, they have to have a C-section with the second child?
Not true anymore. It used to be when they did a C-section, they would go like this, right down the middle of mom. And what that meant is that the uterus was weak in the spot where they cut it. So the next baby, when it started to squeeze, it would rupture at that spot where the C-section was. Now they do what's called a low transverse C-section, so they do it right down there at like the bikini line, and that means that the cut is through one of the thicker parts of the uterus, so in a subsequent pregnancy, there's plenty of strength there. So that's not true anymore. We call that a VBAC, vaginal birth after cesarean. And they're very common today because of all the things I was just talking about. Vaginal birth is better for the baby. And midwives would argue it's better for mom too. They'll tell you, babies delivered by C-section, there's higher incidence of baby blues, postpartum depression. There's more problems with lactation. Why? Just remember, this is a complex process that's evolved over a billion years. C-section undoes that. It does it a totally different way. So, of course, there's going to be effects. Yeah, but good questions. So you really do. You want to have a vaginal birth, even though, it looks like, why on earth would I ever want to do that when I have an option? It's better for the baby. It's probably better for you. And more, you're hard pressed to find an obstetrician who will just schedule a C-section because you want one. It's not like that. They'll give you the whole long speech and say, I'm not going to do it. If you want to do it that way, you're going to have to go to somebody else. So it's a big deal.
I've seen dogs and cats give birth. And how do they deal with the umbilical cord? To me, they just eat it.
Yes, they do.
And the placenta, why can't, not that we want to eat it, but why do we have to cut it?
We don't. That's in other countries, it's done differently. Teeth are used to separate the umbilical cord. Yes. Burnt, yep. Cauterized.
Not in this.
Yep. And the eating of the placenta, which in our culture seems like a really foul thing to do, is an ancient custom in many cultures. And it makes sense. There's a ton of nutrition in the placenta, and why let it go to waste?
So if we just cut the umbilical cord ourselves, the blood just sort of...
No, the umbilical cord evolved for this. So it'll go, whoop, it contracts down on itself.
Oh, so we're just fancy and wait for it to dry out and fall.
Yeah. Well, the baby still has a stump. We'll have the stump at the end. That's...
The dogs don't.
Well, it's because mom has nipped it off. Yeah. We could probably do that too, but we don't. We let it sit. Yeah. Good. Other questions?
Oh.
It's why when you see dogs or cats give birth, there's a lot of licking that happens that mom does. It's because babies come out covered in stuff. Amniotic fluid is kind of slippery. Babies have this, it kind of looks like cottage cheese in just a little preterm babies. And it's just, their skin is covered with stuff during development. So yeah, they need a good cleaning.
Do you have to give birth in that, laying down
No.
position? Okay.
Again, that is a thing that we human beings invented, probably because we invented beds, right? So there are other approaches. The squat is a common approach. Many would say mom can provide more abdominal force that way and deliver the baby faster. So no, this is just one way. And when you do it in a different way, you change this down and up into a straight down forward.
Would it hurt more to squat?
Huh?
Would it hurt more to squat? Why do I feel like that would hurt more? Like, Not before it's like straight down.
Well, but the quicker the baby passes through the birth canal, the less pain there is for mom. Because this part involves a lot of stretching of things that aren't been stretched before, particularly in the first pregnancy. And remember how we talked about in the urinary system, how women that have had multiple pregnancies leak urine? It's because the urethra is one of the things that gets stretched in this process. So, other questions? This is the simple version. This is everything worked right, right? You know, in humans, we do have more problems with birth than most animals do, but it's because our babies have giant heads. You know, for the size of mom's pelvis, it barely fits. You know, we've actually got skeletons in the room. Now, granted, these are male ones, but this is not a very big hole, right, to pass through the bones. So, you know, we do have issues, and sometimes, you know, this has to be expanded, so they'll make an incision here, an episiotomy we call that, or an incision here, which then, of course, has to be repaired afterwards, but you got to get the baby out, right? The last thing you want is baby stuck like this. You know, this is an emergency C-section. If this stays like this for 20, 30 minutes, or the baby's heart rate starts to fall, boom, they'll rush you off to the operating room and pull it out the other end. All right. Okay, that's all I wanted to talk about today. Lactation we already talked about at length before. And this you kind of already know, which is a lot of things have to happen to go from giant head, little body, right, giant eyes, long, lanky thing, right, barely wide across, to adolescence and maturity with greater height, greater complexity to shape, and greater capacities. So, that you already knew. It is a cute baby, though, isn't it? Little round head, blue-eyed baby. All right. Good? Questions? Okay. Whenever you get the chance to be a part of a delivery in your futures, take it. Right? Because not only is it cool medicine and cool biology because it's a natural process, but it's also one of the happiest things that happen in hospitals. You know, hospitals, typically people are sick, you know, and things are not good. But spend a day in the delivery ward and you come out just feeling like this is the greatest job in the world, you know, because everybody's happy. And you get to see brand new lives. And newborns are cute in their own way. They're little alien life forms in some ways. But, you know, we're wired to think that they're super cute so that we'll take care of them. Yeah.
I just have a quick question. My best friend was due in a month, and her baby was breech, and they were telling her she didn't flip in 2 weeks. They needed to do a C-section.
Mm-hmm.
But
there's not a lot of factors.
She ended up flipping on Sunday. But then I randomly saw her dad last night, and we have our friend's wedding to go to this weekend. And the doctor told her that she was nervous about letting her go to the wedding, because she was already 2
centimeters dilated.
That's what that was, 2 centimeters dilated.
Very common. So as the cervix effaces, it dilates a little. You know, so you can stay 2 centimeters and 50% effaced. You can be there for 2 weeks. But depending on what they know about the patient, they may be worried that it's going to be quicker than that.
So if she's due in a month.
First pregnancy, I'm assuming?
Yeah. So if she's due in a month, that seems like really early to be that.
Oh no, 4 weeks early is not a big deal.
I mean,
4
like,
weeks
it
early.
Seems like if she probably gonna have the baby early then?
Probably. Hard to know though. I mean, I'm telling you, people can stay 2 centimeters for 2 more weeks, and then she's not technically early. Because you know there's a range.
Yeah.
We say the baby's due date will be here. Well, give or take 2 weeks. You know, because development is different for everybody. Some of its position. It's not hocus pocus, but there's nothing fancy about the water. It's more about allowing mom to be in a better position, supporting mom's weight. And some would say, I think part of it is the baby is living in water. So it is a less abrupt transition for the baby. They go from water to air instead of from water to air, which can be kind of startling. It's fine. Technically, the baby can't drown until the cord is cut, because the baby doesn't take their first breath until the cord is cut, so they can't drown. Their lungs are filled with fluid again.
What are your clinician take on natural births as opposed to like getting epidurals and fentanyl and other medications?
I am a fan of the epidural. I think the epidural is the best of both worlds. You get, the baby gets the benefit of the vaginal birth. Mom gets the benefit of the vaginal birth without all the pain that's associated with it. So I would always convince people to do the epidural. Now, would I get on a high horse and say that's the way you should do it? No. You got to make your own decision about it. Yeah.
Was the epidural any other procedures like on the I had one person tell me that on the epidural like on the babies.
No, the whole reason we use an epidural is the medicine in the epidural can't get to the baby because it's not in mom's bloodstream. So we put that medicine around in the fat around their spinal cord, so it numbs the pain, but the baby experiences none of that. It's why fentanyl is a different story. Fentanyl, baby's gonna get some of that, so you don't want to use anything like that. It's why anesthetic, you try not to use that. So like C-section, mom is usually under a local anesthetic or a spinal anesthetic, so she's awake. Because you don't want that gas getting to the baby, because the baby's going to come out asleep then. And now you've got to wake them up, bag them until they start breathing on their own, which happens more often than you think.
I've experienced epidural, and one drawback for that is that I couldn't feel the pain, so I don't know if I'm contracting. So my OB would say, now push, because that's when they can feel it. So that's one drawback for
Yes, you lose the sensation, and you do lose some of your muscle control, particularly if you have too much medicine in the epidural, which is easy to do. You're right about that. You want to have a light epidural, take the edge off, so to speak. Yeah.
My mom doesn't feel her epidural.
Huh?
She didn't feel it. It didn't work on my baby's brother. He just came out.
Oh, like it didn't work?
No.
Yeah, sometimes they don't work. If they're not in the right position, they don't work. And depending on where you're at, if you arrive and you're going to deliver in an hour, there isn't time to put an epidural in either. So sometimes that can happen too. First birth, I think an epidural makes the whole experience better for everybody. After the first one, the babies can come out so fast. If you have a fit mother, physically fit mother, second birth, sometimes the baby's there in 20 minutes. And even for first births, because when I worked in the military, so a lot of fit people in the military, right? And the moms that made first pregnancy and delivery look like the textbook were fit moms with a lot of core strength. Whoop, out comes a baby. And usually they're back on their feet a couple hours later, they're wanting to go home the next day, because they're starting out at a state of health, and a state of fitness. So they make it look easy. That's the way to do it. All right, I'm going to stop because we got to get to at least one of these partner presentations today because we had folks prepared.